The glycated hemoglobin test, or A1c test, is performed to measure the blood glucose level. In this test, a venous blood is taken and analyzed in laboratory through techniques like paper chromatography, immunoassay, and boronate chromatography. In HbA1c test, the normal value ranges from 4 to 5.7%. If value is above 5.7% and less than 6.5, then this state is called prediabetic state. The value above 6.5 is alarming and indicate type 2 diabetes mellitus. The HbA1c value varies in different age groups. For people between 20 years to 39 years, it is maintained at less than 6%. For age group 40 years to 59 years, it must be approximately equal to a 6.1%. For people greater than 60 years, 6.5 is acceptable. There are some special considerations for aged people. For patient of age 65, if he is healthy, the HbA1c must be maintained at less than 7.5%. For patient facing some health issue, HbA1c must be maintained at less than 8%. If he is facing poor health, then value must be maintained at less than 8.5%. For healthy person greater than age 65, the overall value ranges from 7.5 to 8%. For healthy, it is 7 to 7.5%, and for health-compromised patient, it is 8 to 9%. For patient above 70 years, it ranges from 7 to 8 for both functionally independent and dependent patient. For patient with comorbidities, it must be maintained at 9%. To understand how HbA1c test measures the blood sugar, we should come to know about the glycation process. In glycation process, the sugar present in bloodstream start to with oxygen carry protein of red blood cell hemoglobin. As we know that the lifespan of red blood cells is 3 months, so this test measures the amount of sugar coated on hemoglobin in this period of time. So if we are measuring the blood sugar level of last 2 to 3 months from test, then sugar level of past 30 days have great impact on result. There is no need of fasting in this test. There are some limitations in which this test does not provide accurate results. As we know, anemia leads to the loss of blood. The old blood cells eliminate from the body and new RBCs are formed, so there is less time for glucose to attach with RBCs, hence, the results show less value than normal. The next is iron deficiency. In iron-deficient patient, the RBCs survive longer than their lifespan, so more layers or glucose stick to the RBCs. So test shows elevated value than the normal. When hemoglobin variants are present, such as in case of thalassemia and sickle cell anemia, the structure of hemoglobin is altered in this case. The machine does not examine the blood sample properly and give false result. In patients suffering from chronic kidney disease and liver dysfunction, the RBCs lifespan and body metabolism both are altered THSDS, why the results of HbA1c are not reliable. In pregnant females, the RBCs turnover is fast due to fetus development and expand body volume. The lifespan of RBCs decreases. The reduced lifespan gives less time for glucose to bind hemoglobin, hence, the result is false less value of HbA1c than the normal.